Can TMS treat autism? This is my favorite question. If you couldn't tell.
Sure. So there is, at this point, there is not an adequate database to say that that it can be used to treat autism.
Okay.
But in terms of, our standard expectations that we have randomized clinical trials where people get active TMS or get sham TMS, there are a number of case reports out there. There are case studies that are very encouraging. And in my own hands, I have treated people who have had depression plus autism, a couple of people, and this is now a number of years ago, and the depression got better, which was the intent, that was the clinical intention. The patient and their family also reported, though, that there were some changes, that they described the person as being more present, more socially interactive in the family, just more kind of dialed in to what's going on around them in a way that they weren't before. Now, we didn't do any structured interviews of these individuals because we weren't treating the autism. We weren't expecting to see much of anything there. So it was kind of a pleasant, surprising anecdotal finding. But I think at this point, there isn't an overwhelming set of data to say, oh yes, this should be a treatment for autism. But it's a question which should be addressed because there's certainly a lot of anecdotal evidence saying it could be. And that since there aren't a lot of other treatments that work really well for people with autism or on the spectrum,
if any,
it would be a great boon to have something that we know from evidence, from double-blind controlled trials, really can be effective. And if so, for whom? Because again, autism is not, a homogeneous,
right,
monolithic thing. There are lots of differences between individuals who all have that same diagnosis, but have different symptoms and different strengths and different limitations.
YouTube, do yourself a favor. Check out this next video right here.
That's the one to look for.